Hey, how's it going, everyone? Today we're going to finish up our conversation on the cardiovascular system and its response during exercise. So we know that as exercise intensity increases, the output of the heart is going to increase. So going from rest to maximal intensity, what we see is this direct linear increase in heart rate till it reaches its max point. And so heart rate is going to help cardiac output increase during exercise, but it can really only increase cardiac output to a specific point. Because remember, an increase in heart rate is going to cut down on diastolic filling time, and this compromises stroke volume as we increase exercise intensity. Now, stroke volume does increase during exercise, roughly 10 to 35%. From that rest to maximal exercise. And in those that are well trained and have a high cardiovascular fitness, that relative percentage may be even more. And this helps to shift the Frank-Starling curve upward, right? And the problem is, though, when we start to reach around 85-90% of our max cardiac output, is that the increase in heart rate starts to, again, compromise this diastolic filling time, and then we could see stroke volume start to plateau or even decline a little bit as we get into higher and higher heart rates. And what you're going to see is that this is ultimately going to affect cardiac output. And typically, near maximal exercise and at maximal exercise, cardiac output is going to plateau because of this decline in stroke volume. Now, we know during exercise there are two things helping to assist with an increase in venous return and therefore preload. Two pumps that we talked about in the past were the muscle pump and the respiratory pump. So during physical activity, the contraction of our skeletal muscles is help driving venous blood back to the right atrium. And that helps to increase preload, which helps to increase cardiac output. So we see this upward shift of both the vascular function and cardiac function curve. Another thing that's helping to assist is the vasoconstriction of highly compliant regions, such as the skin, the liver, and the spleen, which avoids this increase in blood volume that is basically being pooled in these compliant regions of the body. So this is helping as well, but again, the large contribution really comes from that skeletal muscle pump. The fact that the skeletal muscles act as a second heart and help to drive blood flow back to the right atrium. One thing we haven't discussed yet when it comes to exercise is the baroreflex. We've talked about in the past how the job of the baroreceptors is basically to signal what's going on in as far as blood pressure is concerned to the brain. And it works in a negative feedback loop. So if pressure goes up, it helps to decrease sympathetic nervous activity in order to bring it back down. And if pressure goes down, then it will carry out these messages and the responses to increase blood pressure back up to its set point. But what we see during exercise is that the baroreflex is basically going to allow for pressure to increase. And that's what we see on the onset of exercise. And this is called the exercise pressor, an increase in blood pressure reflex. And we get a widening in pulse pressure due to increases in systolic blood pressure, right? So the heart is increasing contractility, the heart's producing more output of blood, and therefore that helps to increase systolic blood pressure, therefore that increases the gap between systolic and diastolic, therefore pulse pressure increases as well. What you would expect is that if pressure is going up, shouldn't the baroreflex then work to bring it back down? And that's not what happens during exercise. The baroreflex is actually going to reset to a new higher pressure. And that pressure that it resets to is proportional to exercise intensity. So as exercise intensity increases, so does the pressure. So we are seeing increases in blood pressure during exercise, but what helps not to increase the blood pressure too much is that vasodilation to the working skeletal muscles, which in turn decreases TPR, and that minimizes the increase in BP that would be seen if you just had the vasoconstriction of inactive regions and the increase in cardiac output that is produced from raising sympathetic nervous activity during exercise. Maximal intensity exercise requires a high amount of skeletal muscle blood flow. We need to get blood and we need to get oxygen to the working skeletal muscles in order for them to keep up with exercise intensity. So we increase cardiac output and we vasodilate to that active skeletal muscle tissue. The problem is that as you start to vasodilate more and more with exercise intensities increasing, well, that's going to decrease total peripheral resistance on the arterial side, and therefore that's going to start to impact mean arterial pressure. So at maximal intensity exercise, the brain sort of has to weigh out blood delivery and oxygen delivery to the skeletal muscles, right, which is going to require vasodilation, or do we try to protect mean arterial pressure by vasoconstriction? And basically, throughout all of the exercise intensity up until that maximal point, it's been able to balance. It's been able to vasoconstrict in other regions of the body and been able to vasodilate to the skeletal muscles in order to keep that balance between oxygen delivery and pressure regulation. But once we start to reach max exercise, inactive regions of the body are already near max vasoconstriction, so we can't cut blood flow off completely to those regions, and so the body basically picks mean arterial pressure. Again, it's the primary regulated variable. So as you're performing maximal intensity exercise, you're only going to get a few seconds of that effort, right? If we put someone on a VO2 max test and they're running uphill and they're running very fast, you're only going to get, again, a few moments of that maximal intensity. And one reason why that is because the brain, again, is going to pick mean arterial pressure, and in order to prevent a drop, it's going to start to vasoconstrict the muscle and the skin in order to protect that mean arterial pressure. So if you cut off that blood flow to the active skeletal muscle, well, it's not going to be able to keep up with that intensity, and that's why we sort of peak at that intensity. And then, the person has to quit. And so a problem that can come about with that is that, the skin vasoconstriction helps to protect mean arterial pressure at the expense of temperature regulation. And so, sort of relating that back to the field, when you take someone through a maximal intensity test, one of the signs you look out for a lot of times is sweating. And if the person stops sweating, that could be a sign that, the body is starting to vasoconstrict to the skin, and that may cause an increase in temperature. So you really got to keep an eye on the person when they're going through that. But basically what we just described is that at maximal intensity, the body has to pick between oxygen delivery and mean arterial pressure. And again, being that mean arterial pressure is the cardiovascular system's primary regulated variable, while at max intensity, it's going to pick mean arterial pressure and do things that sort of contradict exercise performance, vasoconstrict active muscle and the skin. What we are going to see is that immediately following exercise, there's a big decrease in blood pressure, and this is known as post-exercise hypotension that may persist for up to a few hours following that exercise. And so immediately following exercise, we're going to see a drop in sympathetic nervous activity, and that's going to cause heart rate and cardiac output to drop back towards baseline. You could test this yourself. If you took your pulse during your exercise, if you were nearing the end and then stopped, within a span of a minute, 2 minutes, 3 minutes, depending on your cardiovascular fitness and your cardiovascular endurance, what you're going to see is that your heart rate should return back to baseline levels, and that's what happens for most people, right? And so that decrease in sympathetic nervous activity is going to bring down cardiac output and therefore mean arterial pressure. But also what we have too is that vasodilation to the skeletal muscle is going to remain and isn't as quick to recover as that drop in cardiac output. So again, we see these decreases in blood pressure, and that's why it's recommended to take clients and patients through a cool down, because it helps transition that person from exercise to resting, and sort of helps to prevent that huge crash in blood pressure immediately following exercise. So along with this, heart rate recovery can be used as a tool to measure cardiovascular fitness and health. And so traditionally, you have assessments like the YMCA step test, where you have a person step step up and down for 3 minutes, and then immediately you are going to find their pulse for a minute. And ultimately, the quicker the recovery or the lower the heart rate, the more cardiovascular fitness they have, right? And so recovery of heart rate is highly correlated with cardiovascular disease outcomes and may be more predictive than heart rate response to exercise itself. So it's a good way by measuring heart rate recovery to test the person's level of cardiovascular fitness and cardiovascular health. Now, when we think about exercise, there's potentially two things on the cardiovascular side that could limit your exercise performance. The first would be the skeletal muscle O2 utilization, the extraction of oxygen from the blood, and also the delivery of oxygen or blood flow to the working muscles, right? And so we're dealing about really oxygen extraction or AVO2 difference, and delivery of O2 would be cardiac output, and the ability then to deliver blood to the skeletal muscles. And so we know that muscle O2 utilization does not appear to be a major limitation in most healthy humans. As blood flow is delivered to the skeletal muscles, most with healthy working skeletal muscles are able to extract oxygen out of that arterial blood to be utilized as ATP. And so really the limitation to performance comes from inadequate blood flow. The skeletal muscles are able to take on something like 60 liters of blood per minute, right? And max cardiac output for most individuals is around 25 liters per minute. So the muscle outstrips the ability of the heart to provide that blood flow. Now, what limits cardiac output and what really limits VO2 max and what limits exercise performance is really going to boil down to stroke volume, right? Although, heart rate increases to its max point, once it gets to that max point, it can no longer contribute to increased cardiac output and therefore VO2 maximum. Stroke volume, again, is going to begin to plateau and decline. The left ventricle is not going to be able to fill up with as much fluid. This limits the cardiac output at maximal intensities and therefore is going to limit an individual when they hit maximal intensity. Now, as a person is more athletic and the more that they train, this increases the contractility and the ability of their heart to increase cardiac output. And that's really why you see, those with a higher cardiovascular fitness and cardiovascular endurance, they're able to produce higher VO2 maxes. So the greater you're able to get the stroke volume, the greater you're going to raise cardiac output and therefore VO2 max. But at the same time, it is the limiting factor when it comes to exercise performance. Ultimately, today we talked about exercise and what happens to our cardiovascular system. We said that the heart rate can limit cardiac output and then therefore limit exercise performance. We talked about the resetting of the barrel reflex, which allows pressures to increase as exercise intensity increases. And we also talked about the distribution of blood and the ability to balance the oxygen and blood flow delivery with mean arterial pressure. And as we reach maximal intensity of exercise, we're limited in our cardiovascular ability, and the brain will ultimately pick to protect mean arterial pressure at this max exercise intensity and start to vasoconstrict to active skeletal muscle tissue, which limits performance. Thank you guys so much, and I will see you next lecture.